Rahim. So let's talk about the second degree heart block, right? So I have drawn this diagram here, so you can see here this is called as the SA node, right? This is called as the AV node, right? And between these two we'll have these are called as the intranodal pathways, right? And then we'll have this bundle, that is, this is called as the bundle of His, right? Then we'll have the bundle branches here, right? Okay, so then we'll have these small branches. These are called as the Purkinje fibers, right? Okay, so when there's dysfunction of this node, so we can see here the condition that is called as sick sinus syndrome, right? When there's high vagal tone of SA node, we're gonna call it as sinus bradycardia, right? When there is some lesions in the pathway which are present between the intranodal pathways, right? These are called that condition is called as the first degree heart block, right? When there is problem in the node, AV node itself, right, it is conducting, but it is conducting slowly, right? So we're gonna call it as a Mobitz type 1 heart block, right? Also known as Wenke-Beck phenomena. When there is complete dysfunction of this node, right? So we're gonna call it there will be no pulse that will be, you know, passing from the AV node, and bundle of His is gonna take over, and it is gonna contract the ventricles, and SC node will be contracting the atria, right? So basically there will be AV dissociation. The condition I'm talking about, when there is complete dysfunction of AV node, that is called as the third degree heart block, right? Also known as Stokes-Adams syndrome, right? Okay. When there is problem in infranodal, right? When there is problem in bundle of His, right? So it is capturing some beats, right? And that condition is called as the Mobitz type 2 block, right? So I'm going to talk about that right now. So let's talk about the second degree heart block, right? So we'll have two types of that. One is called as Mobitz type 1, and another one is called as the Mobitz type 2 heart block, right? So let's talk about these. Okay, so basically the patient is going to complain of dizziness, right? So in Mobitz type 1 heart block, if we check the ECG here, the problem will be in here we have this SA node, then we'll have the AV node, then we'll have this bundle of His, right bundle branch and left bundle branch. So problem will be AV node. There won't be any complete dysfunction of AV node, but there will be some partial dysfunction of AV node. AV node will be conducting some impulses, but it will be conducting some impulses, but with some delay. So you can see here, so this is P wave, then we'll have this PR interval, right? And then we'll have this QRS complex. So you can see here, so this is the PR interval here. So it is getting prolonged in next beat, it is getting more prolonged in next beat, and then we'll have this P wave, but there is no QRS complex here. There should be QRS complex here. So when we see such condition in which there is progressive prolongation of PR interval, and then we see there is drop beat, there is drop QRS complex, right? So we're going to call it as first Mobitz type 1 block, right? So we're going to treat it as that of first degree. Now if the patient is symptomatic, so we are going to give this patient to atropine 1 mg, right, IV, or we can go for the temporary pacemaking, right, temporary pacing, right? Okay, so we see the progressive prolongation of PR interval until P is not followed by QRS complex. So right, the next condition is called as Mobitz type 2 heart block. It is more malignant, right, because there is sudden halt in activity. So problem will be in bundle of His basically, right? So bundle of His will be capturing some, it won't be conducting some one or two impulses, right? So let's check the ECG. So there will be constant PR interval, it can be normal, right? It will be constant and it will be prolonged, it can be normal, there will be no progressive prolongation, right? So you can see here PRS P or interval is here, but it is prolonged. You can see here again it is of same length, right? Then we can see PR interval is again prolonged but is of same length, and then we can see here P is not followed by QRS complex, right? So when there is no prolongation, there is no progressive prolongation, but there is constant fixed length of PR interval until a beat is dropped. So this is called as Mobitz type 2 block. So in this condition, patient heart and patient is not used to that. In first degree in Mobitz type 1 block, patient heart gets used to that because of there is progressive prolongation, and then beats get dropped. But in this condition, problem is in bundle of His, problem is in infranodal problem. So there will be sudden halting activity of the heart, right? So it can cause sudden death, right? So this is more dangerous, so we will have to go for permanent pacemaker in these patients, right? So treatment is permanent pacemaker, right? So I think that's all for today. I have talked about the Mobitz type 1 and type 2 heart block in this video. In the next video I'm going to talk about the third degree heart block, right? So that's all for today.